Hi there, I'm Amanda. I'm one of the hygienists at Springfield Dental Care. So I'm going to be talking to you today on oral hygiene and why it is so important. So what we'll do is we'll start at the very beginning. We'll talk about something called biofilm. So what biofilm is a slime layer that coats your teeth. Everyone gets it. And what happens is bacteria gets attracted to this slime layer, and eventually over the course of a few days it becomes thicker with bacteria sticking to it. And this is what plaque is. So plaque is visible bacteria. It's also made up of food substrates and saliva. So this bacteria is not very good for you. Firstly, it can go around the gum line and damage the bone and the gum that hold the teeth in. So it's not very good for them. Eventually they become loose. Also as well, it can go into your bloodstream. So that's not good either. It causes inflammation in the body. So this is linked to heart disease, strokes, diabetes, arthritis, Alzheimer's and cancer. So generally this bacteria ain't good. You want to get rid of it. So the best way to get rid of it is to brush your teeth twice a day and also use interdental aids such as TP brushes and floss. So the interdental aids, they come in a variety of different sizes. So here, for example, you can see this packet of TP brushes. This is a mixed pack. They come loads of different colours, ranging from pink all the way up to black. Some are thicker than others. Everybody's got different gap sizes between their teeth. Generally, I'd say most patients are about 2 or 3 different sizes throughout. Also as well, floss. So you can get floss that comes in a stick like this, my favourite. These are great because they get right to the back. But you can also just buy normal floss that's just a string, easy to use as well. Again, a dentist and a hygienist can teach you how to use either of these things. Toothbrushes. Generally, we recommend an electric toothbrush as the best method to clean your teeth. The reason being is that this one, for example, has a pressure sensor. So if you press too hard, a red light will come on. So this will train you at what pressure you should be brushing at. Also as well, you might notice it has a round circular head. Now this is good because it goes round in a circle. You can get right into the gum lines and it oscillates along the surface there, getting right into the nooks and the crannies where a bigger manual brush might not do it so successfully. If you're struggling to get into the nooks and crannies, some people have more crowded teeth than others, or a gag reflex, or gaps and just harder bits to get to, you can use one of these. This is called an interspace brush. These are brilliant, just to get right in there along the gum line, break up all that biofilm, kill the bacteria, job done. So to kill bacteria, you have to break the cell wall. Bacteria is a cell. So using all of these products will do that job. The bristles, the floss, the string, the brushes, they'll touch the cell wall and break it and it will die. And that's how to kill bacteria. So mouthwashes, for example, won't do this job. They're nice, they make your breath smell good, they taste nice, you feel really fresh, but it's not really doing the job as well as a TP brush or floss or a toothbrush will be. It will kill some bacteria, granted, but not as successfully as physically touching the cell and breaking it. What mouthwash would be doing is skimming over the top of it. Bacteria is quite clever, so it builds like a protective slime layer and it protects itself from the elements. So this is where the mouthwash doesn't do such a good job. If you are going to use the mouthwash, you need to not do it straight after brushing. You need to leave that fluoride on your teeth to do its work. So the best order, if you want one, use all your TPs and your floss, then the mouthwash, then brush your teeth, spit, leave it, don't rinse. Or you can use the mouthwash at lunchtime, for example, after eating, just to wash away the bits and freshen up. Some people need a sensitive toothpaste, for example, Sensodyne. This is a good brand. The way this works is it seals any exposed bits. So it coats what are called the tubules. These tubules lead to the nerve of the teeth and they conduct. So anything hot, cold or sweet will go down the tubules, make it quite sensitive. So the way sensitive toothpaste works is it coats these tubules. So again, don't rinse the mouth out after using it. It works a lot better if you don't rinse. So if you've got one tooth, for example, that's sensitive, you can use normal toothpaste and then just get some on your finger of a sensitive toothpaste, rub it on that tooth like a cream, It works quite nicely. So we're going to leave it here because I've waffled on for 5 minutes, a lot of information. The cat behind me, I'm disturbing her sleep. She couldn't care less about what I'm talking about. And quite frankly, I think she'd have my hands off if I tried to brush her teeth. So you all take care.